therapy. The steps are as follows and will be expanded upon in following discussion. First, define the goal of therapy. Then introduce the concept of subliminal therapy by lecture, as is demonstrated in the video, or aided by having the patient read the introductory booklet on the subject. Then establish communication with Centrum and enlist the cooperation of Centrum. Then request that Centrum investigate the cause of the presenting problem. Then request that Centrum identify those parts of the mind responsible for the current problem. Request that Centrum determine the beliefs of those parts regarding the presenting problem, and request conscious understanding of the positions held by those parts. Then reflect conscious opinion, and request that Centrum communicate with those parts, educating them about present reality, present life needs and values. Affirm successful completion of each step by appropriate questioning of Centrum. Then identify any remaining errant parts by requesting Centrum to investigate the possibility of their existence. Then repeat steps 5 through 12 until no remaining errant parts are identified, and request full conscious awareness of the work just completed. And then finally, test completeness of the work accomplished. It is consistently advisable to define the goals of therapy at the beginning of the therapeutic relationship. The goals are best articulated in a simple expression of conscious desire and should be well thought out and clearly understandable to both the patient and the therapist. Not only does this step afford direction for the therapy, it also affords a measure of effectiveness of the treatment. It seems necessary that the patient have a general comprehension of the process of subliminal therapy. However, exhaustive explanation is unnecessary since the process becomes clear in the course of application. Introductory instruction may be accomplished by lecture or may be more efficiently accomplished by having the patient read the introductory booklet, the availability of which is detailed at the end of this course. To enable the therapist to intelligently guide the course of therapy, communications from the unconscious domain to consciousness must be established in ways that are clearly identifiable as such, and it seems that some parts of the unconscious domain are aware of and cognizant of all conscious perceptions. The unconscious domain is taught to communicate to the patient at a conscious level of awareness, thereby providing indications of completed work when a requested step has been accomplished, or to provide requested information. This information, as perceived by the patient, is then orally reported to the therapist. The vehicle of this unconscious to conscious communication can be through any of the senses. However, the use of an imagined chalkboard on which Centrum can write is preferred for pragmatic reasons. Other examples of unconscious to conscious communication include listening to an inner voice, and by the use of idiomotor signals, such as coded finger motions, wherein the unconscious is taught to assume control of the fingers and to respond by that means. To enable the therapist to intelligently guide the course of therapy, communications from the unconscious domain to consciousness must be established in ways that are clearly identifiable as such, and it seems that some parts of the unconscious domain are aware of and cognizant of all conscious perceptions. The unconscious domain is taught to communicate to the patient at a conscious level of awareness, thereby providing indications of completed work when a requested step has been accomplished, or to provide requested information. This information, as perceived by the patient, is then orally reported to the therapist. The vehicle of this unconscious to conscious communication can be through any of the senses. However, the use of an imagined chalkboard on which Centrum can write is preferred for pragmatic reasons. Other examples of unconscious to conscious communication include listening to an inner voice, and by the use of idiomotor signals such as coded finger motions, wherein the unconscious is taught to assume control of the fingers and to respond by that means. Even a Ouija board can be employed for this purpose. Communication with Centrum in such identifiable ways permits necessary discrimination between such communication and conscious opinion. This step is demonstrated in the following excerpt from a treatment session. It's a technique that, as I mentioned, I could have used instead of guiding you just to the specific memories. And I want to introduce you to this technique, and we're going to use it. I'm going to guide you to use it. You have to do all the work. I'm going to guide you to use this technique as a way to research, to be sure there's not some other active element here that might still upset the apple cart and cause asthma. Okay? And I have to do a little mini lecture here to set the stage for this. I need to talk about my understanding, my theory of how our minds function, how they're put together. It seems that certainly part of our mentality is conscious. It also seems to me that a much greater part of our mental capacity is unconscious. And I want to teach you how to take advantage of unconscious abilities that are not taught in our culture. We don't pay much attention to these kind of things. I believe that our unconscious domain is highly intelligent. It has information that we don't have available consciously. It has abilities that we don't have available consciously. So I want to teach you some things about consciously utilizing some of those unconscious abilities for therapeutic purpose here. It seems that that unconscious domain of our minds is actually not a unified whole, but rather it seems to consist of a great many different parts. By a part, if you learn a new skill, something is there now that wasn't there before. Whatever that is, it's what I'm calling a part. See, a part can represent a skill, it can represent a limitation, it can represent a learned behavior, riding a bicycle or driving a car or walking, or, it can represent most anything. But it seems that the unconscious domain is made up of this vast accumulation of different parts that we have accumulated in the course of life. We might call this the mechanism of conditioning. Does that make sense to you logically?
Yeah.
Okay. And it seems that one or more parts of the mind may take a sort of autonomous stand and exert influence in ways that we consciously don't want. resist, we don't like it, it's a problem. In this model of the mind, I would say that some part of your mind has been causing you to have asthma. Okay? Somebody else, it might cause them to be afraid of the dark or whatever. So our task here in therapy, in correcting this, becomes a matter, first of all, of identifying that part of the mind that's creating the problem, or parts. There may be multiple parts contributing. And then educating them, growing them up, letting them become aware of the negative consequence of their influence on life as it is now. See, you've heard of Freud, Sigmund Freud. He used to talk about arrested development. That's kind of the same thing, except now we're talking about the arrested development of just a part of the mind. For example, if we put a little girl in a dark closet and just terrify her, it would be very logical that she would learn to associate fear with the dark, and for the rest of her life be afraid of the dark. It would make sense. It's logical. Call it a phobia now.
Right.
Phobias are learned, just like asthma. Well, our task then, you see, is to identify that part of the mind that's still afraid of the dark. That part was arrested. It's operating on the basis of what was, in ignorance of what is. So education, then, you see, becomes the vehicle of change. But to do that, we have to be able to communicate with that part. So we have to have some way of accomplishing all of this. So our mentality now is part conscious, much greater part unconscious. The unconscious is made up of these great many different parts that in general function harmoniously. We do pretty well as humans, but one or more parts may cause problems. Another element of this model of the mind, and that's all it is. Marlene, I don't know how our mind is, just a theory, but it gives us a framework in which we can do constructive things. And the next element of this theory is that to explain how all of these parts, most of them at least, function harmoniously, that says there has to be something in the way of communication going on. Otherwise, they'd just be off in their own directions. It'd be chaos. Well, it seemed to me, and I just hypothesized this to be true because I couldn't explain it any other way, that there has to be some other entity there in the unconscious domain, an entity that's able to provide direction and purpose and communication, an entity that more than one of my patients have referred to, well, that's my soul. Okay, fine. However you want to think of that entity, just for convenience sake, name tag on that entity. I call that entity Centrum. And I did this many years before the vitamins came out. Centrum. I presume right over there in that pretty head is the Centrum. Now, Centrum is intelligent. Centrum has the ability to learn, and that's a big part of intelligence. Centrum has the ability also, I'm sure, but we'll be checking it out, but I'm quite sure that Centrum has the ability to remember things that have happened, and Centrum has the ability to communicate with other parts of the mind. Now, if all of this is true, being able to communicate with Centrum and persuade Centrum to cooperate to to work in these ways, that would be a really valuable skill to have. And it turns out that that's possible. Communicate. See, I presume that Centrum is listening to me right now. I believe the Centrum hearing me. The problem is getting some communication in the other way, in the other direction, because it hopefully needs to be identifiable so that we can differentiate, tell the difference between that communication and conscious opinion. Because conscious opinion hasn't solved the problem. So we need a way of differentiating. There are several ways we can do that, but in fact, communication of this kind is not an unusual phenomena at all. As a matter of fact, it happens every time we remember anything. For example, if I ask you, how do you spell cat? Well, you know how to spell cat, but that wasn't on your mind before I asked the question.
Right.
Well, if it wasn't on your mind, where was it? You know, you're pretty well forced to conclude that, well, it wasn't conscious, therefore it must have been unconscious somehow. And I asked the question, and the answer was communicated from the unconscious domain of your mind to consciousness. Now, we don't normally pay any attention to this process, but in fact, we can be aware of it. It happens through our senses. A sense of sight, a sense of hearing, a sense of taste, a sense of touch, you know, through our senses. So you just be introspective for a moment. And let's see, how do you spell cat? Now there's the answer. How did that answer come for you? You see the letters? Did you hear the letters? I've even had people tell me they feel them. I don't know what they mean by that, but I didn't argue. How did it come for you?
I could hear them.
You hear them. Mm-hmm. Yeah, I would guess that you learned to spell cat by hearing the letters. Somebody else would learn, who learned by seeing them, would see the letters in their mind's eye.
Right.
Okay? Pay attention now. Maybe, let's see if you can identify the voice. How do you spell cat? Whose voice is it? Recognize it?
I know.
Hmm?
I don't know. I think it's me.
You think it's your own voice?
I think it's me, yeah.
Okay. Fascinating, this, isn't it? So far here, this is fascinating. Okay, so through our senses, this is how it all happens. And we're going to use a preferred way to perceive these communications through the sense of sight. I want you to create, consciously, on purpose, just create an image of a chalkboard and then be curious to see what Centrum writes on that chalkboard. Okay? Got your chalkboard?
Yeah.
Okay. I ask that Centrum, your Centrum, indicate willingness to communicate this way by writing the word yes. Y-E-S. Yes, they're on that chalkboard. Just let me know when the word yes appears.
Okay.
Okay. Now you might say to me, well, yeah, but you know, I can imagine a chalkboard with yes on it or no on it or anything I want on it. I can change it, I can erase it, I can do whatever I want to. And of course you can. But when Centrum communicates, it's somehow different. Probably you'll find that you can't even erase it, for example. Is the word yes still there?
Mm-hmm.
Try to erase it. Still there? Okay. Give you another little experience to validate the process here. I ask that Centrum, your Centrum, now select a different word to be written on that chalkboard. I'd like this word to be a surprise to you consciously. A word that you will know full well you didn't think that one up and put it there. Centrum, please select such a surprise word and write it on that chalkboard. Got it?
No.
Okay, just be patient a moment.
Okay.
Centrum, is my request clear to you? Please answer that question by writing the answer on the chalkboard. Centrum, is my request clear to you?
Yes.
Okay, then please select that word, some word that will surprise you consciously, and write it on the chalkboard.
No is the only word I can think of.
Is that written on the chalkboard?
Yeah.
What's the word?
No.
No? Are you satisfied that you didn't consciously think up that word and put it there?
Would have tried to pick another word besides no.
Well, I want you to be aware of what you just said to me. I was trying to consciously think of another word, okay?
Okay.
See, the whole key here is that this becomes a way to differentiate between conscious Centrum, give us an off-the-wall word, a real surprise word, please. Got it? Something written on the chalkboard?
Yeah.
What's written on the chalkboard?
Impossible.
Impossible. Okay. Are you satisfied that you didn't consciously think up the word impossible and write it on the chalkboard?
Pretty sure.
Pretty sure? Okay. That's a unique one. Okay. See, I'm just doing this to kind of validate something different is going on here. This is not normal awareness.
Right.
There's something really different going on here. To guide you to use this technique, I must ask questions and pose requests to Centrum for response on your chalkboard. Now, I can't see your chalkboard. I have to depend on what you tell me is there. And so it becomes absolutely necessary that you tell me what's on the chalkboard, not what you think should be there. Most of the answers will be obvious. It'll say yes or no or whatever it says, and you'll know that's right. Once in a while, you'll likely get an answer that doesn't make sense. Once in a while, you may even get an answer that you just out and out disagree with consciously. It should be mentioned that although it is possible for the therapist to communicate directly with identified cooperative parts of the mind, Centrum is usually able to accomplish this communication more efficiently and to accomplish identification of the parts as well. Also, Centrum can communicate with those parts that are unwilling to reveal themselves to consciousness, sometimes doing so even without conscious awareness of the communication process taking place between Centrum and the part. Although there are exceptions, Centrum is consistently supportive of the therapeutic process. It is nevertheless possible that Centrum may hold a viewpoint opposing the consciously held desire or objective. In this case, it will be necessary for the therapist to function as an intermediary, guiding the process of communication toward mutual understanding between the conscious domain of the patient and Centrum, to the end of agreement between them as to the objective of the therapeutic work. Having established communications with Centrum, and with the cooperation of Centrum enlisted, it is usually advisable to ensure that Centrum has the capacity to access memory and to communicate with other parts of the mind. This assurance is obtained simply by asking Centrum if the capacities are present. Centrum is then requested to use those capacities to conduct an investigation in which those parts of the mind that are involved in the presenting problem are identified. Following identification, Centrum is asked to communicate with those parts with the objective of understanding their values and motivations in causing the present dysfunction. Additionally, Centrum is asked to review memories of related experiences when the present problem originated. As a guide to the timing of the process, Centrum is asked to indicate completeness of each task by writing the word complete on the chalkboard or by other means such as a coded finger signal. Having identified the errant parts and having learned from them the reasons, the objectives, and the values held by those parts, Centrum is requested to elevate that understanding to a conscious level of awareness. Assuming compliance, the therapist is then advised to interact objectively with the patient to determine conscious perspective and opinions regarding the information just obtained. Assuming agreement with conscious opinion, Centrum is then asked to communicate further with the errant parts, educating them with the objective of enlisting their support in making the desired change. In the event conscious awareness is denied, the therapist is then advised to investigate the reasons for the barrier to awareness. This is best accomplished by interaction with Centrum to identify the part of the mind that is blocking communication and to learn the reasons for the blockage. Given that information, and by aid of education and persuasion from the therapist, Centrum will likely be able to engineer the desired conscious awareness. Protection of the patient, that is, self-protection from the supposed trauma of knowing, is the most common basis for such barriers to conscious awareness. Note that this process of uncovering unconscious information, evaluating that information from the perspective of mature understanding, followed by re-education of the offending parts, forms the core of subliminal therapy. And this is true whether the work is accomplished at a conscious or at an unconscious level of functioning. The consequent, spontaneous reframing of the uncovered material is requisite to accomplish the consciously desired goal. In some cases, as with the more intellectually sophisticated patient, he or she may have the knowledge and/or skills to construct